point of this video is to walk you through the application of the silver diamine fluoride treatment that's included in the kit, and also a regular brush-in fluoride. So our goal with the silver diamine fluoride that comes in these black capsules is to reduce sensitivity, stop bacteria from creating cavities, and keep you from needing any emergency dentistry in the meantime. So what I'll strongly suggest is that you put on some gloves. This capsule is black for a reason. It dyes or stains things black like you wouldn't believe, and sometimes it won't show up for a few days. On skin, it'll be just a couple hours later, so please put on some gloves. And I'm going to recommend that you create some type of work surface for yourself. So I just have a bit of computer paper. You can even use like the card I'm going to send you in your kit. That's a nice little work surface to kind of keep track of everything, and also keep it off from staining anything you might expose it to. So I'm just going to kind of walk you through what you're going to do. I don't think it's a good idea to try and follow along and do things at the same time. Watch this video through, and then if you need help, I call and we can walk you through it kind of live in person. So I've done this treatment on myself, so it's manageable to do it on your own self. A child or a teenager you might have some help with, or if you want a spouse or someone to help you, that's good too. But it is reasonable to do it on your own. The first thing I would say is have clean teeth. So go ahead and brush your teeth like you normally would. You could also use the new toothbrush in the kit to kind of do a dry brushing, that after brushing your teeth, to kind of get rid of like any saliva bubbles and moisture. And then I also have some gauze included in the kit. So if you have an area that's particularly sensitive, or you're worried about because we maybe diagnosed a cavity on, or you have a place that catches floss, go ahead and dry that area with gauze. And it doesn't have to be bone dry, but it's certainly reducing the moisture in that area is good. So assuming that area is reasonably dry, you can find what type of brush is going to work well for you. Myself, I had a worn area in the top of the tooth, so any of these would probably work best. If you're going to go between the teeth, there's the green and pink, and if you look close, the pink one's a little bit smaller, so this model is a lot larger just for visibility, but it's a lot easier to nestle that pink one right in between. So I would guess if you're going in between, which is where cavities really like to be, I would suggest using that pink brush. I'm going to go over a floss application, which is why this yellow brush is in place. And if you have a wide place, or you're going to do the tops of the teeth, and that's your sensitive spot, or along the gum line, then this green brush is the way to go. So those are your brushes. Next thing you do, you're going to carefully pop open and not spill the contents of your little black treatment. I have an empty one, so I'm just going to say what you do. You give that a twist, really strong, and the lid will pop off, and your liquid is inside. So what you can just go ahead and do is put your brush in there and wiggle it around a bit. It is technically blue, but it's going to be hard to see even when you do it for real. And then just, oh, I've got some, see, there's residue in there. It must have stained it black. So anyway, you're going to go right in between the teeth with that, and along the gum line, and right in between. And like, if you're assuming you're going to paint that, and you're probably going to need a few dips if you're going to do another area. So you can pause in between and do a few areas. When you paint this on, it sometimes can sting the gum a little bit, and it doesn't taste great. So I would also have you have these guys handy. I have some gums and some pasties, or little candies that help with the flavor. So these ones, because they're xylitol, they're okay to have in your mouth, but you should not rinse after this treatment for 20 minutes. So I should leave it in place. Well, let's pretend that this is on a child next. So that is simply just brushing it in, and then kind of managing your taste with a pasty. So that would probably work very well for an adult. In my office, what I do for children is a little bit different. Their decay tends to be in between the teeth. With a child and decay going in between, we're going to apply some SDF that is going to help with cavities in between the teeth. As a parent, if you need a mirror to kind of spy where you're going, I've got one included in the kit for you. And the floss I want you to use is this expanding floss. And I'll show you why in a little bit, but for my demo purposes, I'm going to use yarn just because it's still a lot easier to see on a video. So go ahead and get yourself ready with a placemat for all the items that you need. Some gauze, your mirror, the expanding floss, the mints, the brushes, and the fluoride varnish. So what you're going to do is, as best you can, clean the teeth with the regular brushing in advance, and then maybe even a dry brush just to kind of remove extra moisture. So you could use your regular brush and then your brand new toothbrush out of the kit to kind of get rid of any extra debris and saliva bubbles. Then you're going to dry your area of concern. If you're doing a whole mouth, you might want to do it in segments or areas at a time. So go ahead and dry the area you're concerned with. When you open your capsule, be very careful. It will color anything it touches and stain things black, including your skin. So please wear your gloves and be mindful of what this comes into contact with. So you give it a good twist and it pops it open there. And in my office, I'll often get the floss ready. I'll pop it in between the teeth where it needs to go first. With this expanding floss, why I like it is because it comes out kind of like a regular floss at first, and I don't know if you'll be able to see it on the video, and it's not wet, so it doesn't maybe give the same effect. Come on. Anyway, once it gets a bit wet, it kind of puffs up, and it will hold the liquid on the floss a lot better, because what you're going to do is use the yellow brush with some bristles, and then pick up some liquid, apply it to the floss until you see it a bit soaked on the floss, and pull it through, and just to where that liquid is nicely between the teeth. Now, as I mentioned, if you're doing that on a child, this doesn't taste very good. So then if you're going to do another area, maybe you take a break and let them chew one of the xylitol candies. If you can manage to get a whole mouth done, but you're wanting to manage how it tastes, another thing you can do is put the varnish over top. Ideally, once you floss that in, we actually want it to stay dry for a minute. So that's a really long time. If you were worried about that, my suggestion would be to dry it really good. Maybe use the smaller pink brush to go in between as best you can. Kind of cover it and try and hold them still for the minute. And once you've gotten through a minute, you can then paint on the varnish. So the varnish application, if you don't need it in this procedure, you don't have to use it. We just use it to kind of cover up the varnish or cover up the SDF treatment, and so the flavor is a bit better. You can, however, save this and use it on its own at a different time. So there's kind of this goopy paint inside the well, so just mix that together, and you just paint it on. We normally do a little paint along the gum line. You can go on the inside too to help against flavor, because that SDF does not taste very good, and it can sting a little bit when you put it on as well. Not bad, it's just kind of a mild medicine type of, oh, it's doing something feeling, but kids can be pretty sensitive to those types of things. And then again, do not rinse, brush, or do anything, just leave that on in place for a good half hour. And that is it. When you are ready to dispose, this is what I suggest you do. You hold this in your hand and take the glove off around it so that it is now nicely encapsulated in your glove and it won't stain the rest of your household.